you now have an idea of how the research framework would be formulated. Okay, so for the framework we have what is that? It means a framework is the overall conceptual underpinning of a study. So which means on how you are going through with the study, on the concept of what you are trying to investigate or to collect data with. Okay, it's the underpinning. So the overall on how you look at it. This is how you're going. This is how you want this, or this is how you want this to be done. Okay, so it's based on the literature that you have reviewed, and you should be able to show and explain how the different variables in your study relate to one another and why. Okay, so it means like you are trying to delve on the topic based on what you have read and on the previous studies and how it will be connected from one to the other. Okay, and also there are two types of framework. Okay, I think you have an idea of these two frameworks because in the undergrad, I think you have made researches, right? Okay, so one of which is the theoretical framework, okay, and the other is the conceptual framework. So what's the difference between the two? Okay? When we talk about theoretical framework, okay, according to Brink in 2001, a theoretical framework should be used when the variables have been studied before and have been found to be related to one another. Okay, so the theoretical framework is already a concept or a theory that were done or is also validated and have been known for a long period of time. For example, we have you either have a theory that explains the actions of your variables or a proposed explanation given by another author who have done similar studies on the same variables. Okay, and this framework can either support or refute the results of your study. So either it can, so which means it validates or or it validates your study or it reinforces your study or it can either be a disagreement with your study. Okay, so Nussbaum in 2008 views theoretical framework as broad general explanations of the relationships between concepts of interest in a research study. For her, it is based on one existing theory. Okay, so an example of a theoretical framework is a is the health belief model or the HBM. Okay, this was developed by Hochbaum in 1958 and modified by Rosenstock in 1990, wherein there are several factors that should be taken into consideration if one intends to effect certain health-related behaviors changes. Okay, so although it's a very old model, the health belief model, in fact, some of the researchers in our institution is also doing such or utilizing the health belief model. It is a very old model, like I've said. Researchers in health promotion and education still find it useful in explaining certain health behaviors. Okay, and example of this, the health belief model by Rosenbach in 1990, with regards to these are the health belief model, the perceived susceptibility to a certain disease or conditions. Wait a minute. Okay. The perceived severity of the disease, the perceived benefits of the recommended actions, the perceived barriers to actions, costs, action costs of or are outweighed by the benefits, self-efficacy or conviction that one can successfully execute the required behavior, cues to actions or conditions which investigate the recommended health behavior, and other variables like the social demographic factors. So this has a readiness and impact or effect to the readiness to take action. Okay, so the health belief model. If you have these beliefs, then you are ready now to take, more or less ready now to take action, which would action such as change in behavior. Okay, I think there were a group of students. I don't know if it's in your class or the other class, the third year's guru. And I was telling them there was no, it was about the health seeking or knowledge, attitude, and practices. And I was telling them there is no prevailing attitude or prevailing knowledge. I know it is some kind like the group defines the prevailing and perception. And I was thinking, oh my God, if you will not follow what I'm telling you, definitely the committee will not approve that. And there's no such thing as prevailing. It's prevailing rates, like it goes with the money or prevalent, like in some numbers. Usually prevalent goes it's associated with figures or numbers, but when it comes to mind and consciousness or awareness, usually we term is the proper term is perceive or perceptions. Okay, so this is for the health seeking behavior. This is the health belief model that could the theory that could be utilized for theoretical framework. Okay, and then on the other hand, conceptual framework is the other type of research framework in which it's sometimes called a conceptual model. Okay, so a conceptual framework is when your explanation is based on the literature about your variables, or when your literature does not contain a particular theory that explains the relationship among your variables. So I believe in the topics that you develop, there were some which does not have the theoretical framework or theoretical theory to be banked upon. However, then you have the option to make both the theoretical framework as well as the conceptual framework. So if your topic supports a theory, then or supports or refutes a theory, then you can make one. But if not, you can just focus on formulating the conceptual framework. Okay. So the explanation will be your expectation. So in conceptual framework, your explanation would be on how you want the study to be going through, or the flow of your study. So based on the literature about the action of the study variables as well. Okay. So here is an example. I will show you an example of the conceptual framework that we are doing in conceptual framework that we have in in our school. Okay, in our one of the papers that were conducted in the masteral program of nursing. So I want you to check on this because I know there are some who have papers that does not need a theoretical framework, but almost all of you should make a conceptual framework. Okay, open. Wait a minute. Minute takdir na babalik. Okay, this one. Can you see this one still? Okay, can you see?
Yes
Nakikita
po.
pa ninyo?
Opo.
Ah, okay. This paper is about, okay, the knowledge, attitudes, and practices on clinical waste, segregation, and management among nurses in a private hospital in Tacloban City. So this was a masteral program project by one of the nurses in one of the tertiary hospitals here in our area. Okay, so it was a KAP on the clinical waste segregation and management, and we all know that clinical waste are also not just infectious, but they are hazards and risks, not just to the health workers, but also well in the community. So on what's the level of knowledge, attitude, and practices of the employees or health worker or nurses in particular in that hospital was being evaluated or researched. Okay, so this is the schematic diagram. Look, okay. So I hope. Anyway, this is you're the first year, so you don't have yet that concept before in making the schematic diagram. It has to be an independent variable to the dependent and the confounding. No, as we said, it's the underpinning on how you expect, so on how you want your study or how your study is going to be tackled is your conceptual framework. So in this one, the conceptual framework that was developed by the author was like this. Okay. So the nurses in the private hospital, it's going up because the nurses in the private hospital, the profile are the one that are being studied, and so that's the core problem. So center, diba, we already discussed in the problem tree analysis. If it's going up, we're looking into the outcome, and if it's going down, we're looking into the determining factors or the causes, right? Remember, nakanumdum ka mo? So in this one, since they're looking since she's looking into the knowledge, attitude, and practices, so it's an outcome on how these people would how these people would know or how they would practice and how they would react to the clinical waste and management at their hospital. So the social demographic profile were being tackled, and then initially she said that if the nurses has this level of attitude, level of knowledge on clinical waste segregation and management, as well as on level of attitude on clinical waste and management, both of this would have an effect on the extent of practice on clinical waste segregation and management. And thus, if she knows this tree, if she can get out the result from this tree, then she would be able to make a clinical waste management model. Okay, all of this um, in your studies, don't go yet to that level of clinical waste management model. I think in your paper you just have to go through up to this extent or up to this identification of variables. So since this is a masteral program and it's a management, so they have to develop some management models. Okay. So what I mean to say is in the conceptual framework, this is how the paper is being viewed upon. So at the end of the whole context of the paper. So all the variables in here are written in the research objectives. Okay. So look into your research objectives and look also on how your paper is going to go through, and that's where you can plot your conceptual framework. Okay. So anyway, yours would only be up to this one. If you have the KAP or health seeking behavior, you put your variables here. So we're gonna check it. Okay. And after the diagram was made, after the diagram was made, the conceptual framework was explained. Okay, briefly, it was explained. So in that particular study, she said that figure one shows the schema of the study. The research will involve research will involve staff nurses from selected areas of private hospital in Tacloban City. Okay, these are nurses who are working the wards and in the special areas of the hospital. So this study aims to assess the level of knowledge, attitudes, and practices on clinical waste segregation and management among nurses. Associations between the nurse's profile and their level of knowledge and attitude and the extent of their practices on waste segregation and management will likewise be determined. So the results of the study will be used as inputs for a clinical waste management model for the hospital. So at your end, we're not that into the clinical waste management model, so we're only up to that portion of determination. So because all of those things that she had written has to be in the objectives of this time. Okay, so in effect, everything has to be congruent, which means kung anong giniristoryahan ng topic, amot giniristoryahan na background, so it has to be related and interrelated. And then from that, amo gyapiti istoryahon dito your research objectives, as well as on the significance of the study and on the definition of terms. So in the definition of terms, whatever variables that you have, whatever variables that you have identified on your conceptual framework as well as on research objectives, you can make them or you can formulate the definition of terms. Always ensure that the variables that you mentioned in in your research objectives as well as in the conceptual framework. Usually, ha, research objective dapat makita mo conceptual framework. All must be defined. Otherwise, if they're not defined, magiging lucky to hiya. So it's going to be, that's how nitty-gritty the evaluation would be. Everything are going to be seen, okay? So anyway, with regards to your paper, I haven't had the time yet to look into them. So I will just have to schedule, and I think on Saturday for our class we can discuss some of the pointers, some of the comments that I would see. Wala pa ako nakakita because I want them to be printed, so I will print them in my office later, so I can have a more in-depth view of your paper, okay? So take note for those who have not submitted and all, even for those who have submitted already, the congruence, okay? The logic. So from this step to this step to this step. Kumbaga, even if always do away with the thought nga, although importante hiya, pero kung diri hiya konektado, dito imo problem statement, which is your title, ayaw hiton pag-apiya. Okay? The other things that would be nice to know with your paper, diri tiya api dida, baya iton. Because it's always a temptation for the students or the researchers for that matter na bagay kasi konektado hiya or may niya kalabutan but it's not within your study na uupod. Okay? So I would suggest to have your background to be just one page or two page. The least is the one whole page, but the maximum is like one or two pages. Not more than that. Otherwise, kung magsubra na ito, like 3 pages na, bangin mahalaki but not yung RRL. Especially if your paper or your study is not that, there's not much local or international documents, makukurian ka, sayang. So in the background, it's more like your own discussions. It's a deductive reasoning. So although you have the inputs coming from literatures and you just have to discuss it more in a deductive reason. Okay, so on RRL, tanan. So from literatures, unahaan na, and then don't forget to make the references and to put some end notes on your references. At this point in time, even if it's really important that you have to make the references because you already have the review of related literature. And even in the background, you can put some references, but not specify according to the study or something like that because it should be in the review of related literature and studies. Okay. So I am going to check your paper within this time period, and we can have the consultation. You can you can PM me when is the possible time for us to have some consultations. But at this point in time, I haven't read them all. So I think I have had like 5 papers who have submitted, right? 5 na nag-submit. 5 pala ano, guys?
Opo, Doc.
5 pala nag-submit ako, no? Yung mga documents.
Opo.
Group 10, I think. Group 3. Group, I will check on it later because I want to print them all because that's how I can make the no, more objective corrections. Okay, so since we still have time, you look into again to your background and as well as in your RRL. I will give you time. I will not give an exams, but what we're going to do is to have your final paper by up to your finals. Okay, so it's going to be a group grading. So I would suggest that each and every one of you should join. And take note, dapat congruence. Di rin naman ito na masubmit, gintarot-tarag kip, di rin nag-aaras siya. Before you submit to me, you talk among yourselves and contribute. Otherwise, if I hear somebody, if I hear from the groups that one or two of your members are not joining or not contributing, ada papagraduhon ko luwat kamot iyo kausa-usa. Okay? So, we will look into that one. Okay? So from this time onward on Saturday, since I'm done with all the lectures for the whole of chapter 1 and 2, and I believe you already know what's the at the institution or at the school, medical school at RTR, for the references, we are using the APA. Okay? You just check on that on how to make the APA. Okay, it's your assignment. So from this time onward up to the your bi-monthly during your classes, then we can have the consultations. Okay? Okay? So in the Zoom that the school would be giving, you can have your break rooms. Okay?
Okay po, Doc.
So again, talk and it's a work in progress. It does not mean nga pag usan niyo pag istorya okay na ito there. It's a work in progress. Look again on it. Okay, sitting pa as a student at this point in time, you have to learn. You have to be up. You have to engage yourself to be part of your research. Okay, yan na as like yesterday again, I have this resident physician like hagi talaga. May dako gimbi pinambasa nga mga 3 or 4 papers gusto ko na ilabog ka bintana. Okay, arang-arang na lang siguro niyo ginhimo. So that's because again, during the college days, they were not listening or not engaging themselves to be part of the research. Okay? So sining pa sa ka-residente kakulop, doktora, until I have my until kuno I have my diplomate or specialty boards or specialty damo nga research it ira kinahanglan. Okay, damo nga research. If it's possible, make your each and every one of you should make your own discussions or background as well as an RRL and you can discuss it and join it. Okay? Pwede niyo pagturot-turot-kupon. Pero sining pa man, pag tugkop-tugkop nga logic, nga may niya sequence nga sakto nga hintama. Okay? So that's all for this morning. Liza, nag-attendance ka na?
Done na po, Doc.
Okay. So, I hopefully, anyway, you can still work on those who have not submitted, you work on it. And sitting pa, I'm hoping that upon the evaluation, there will be no changes on the topic. Kumbaga, topic amo na ito, hindi rin naunta ni Rabduruhon pagbago. So the reason why I'm doing this is because kung ano na't napagsabutan niya na committee, pag abot ni iyo second year, you will now, ira na itatakol nga issue is more, itatakol nga about it, your research is more in the methodology. Dapat di rin na rin nalalabtan ito chapter 1 and 2. So that's what I wanted to impart on the research committee. Because otherwise, kung may daman nila gusto pabaguhon, yan na nila dapat ipabago. Because it's really obvious that the school has a big contribution as well as a big say on our researches. Because all whatever research that we are doing, their name is also part of that. And as I've said, I'm doing this with you in the hope that we can present and we can make more kumbaga, high quality researches. Okay, does not necessarily mean that your students that you cannot make that good quality of researches. We can. So pagbubublikan naton ini niya. In fact, with the third year, since they have already researches R1 or R2, and the third year now, we're able to make a good quality of research. Unfortunately, wala kami makahimo ang data collection, but when I even showed it to the residents na awo dira kay mas makaupay pa ko nun kanang third year. So I was hoping kamo nagtikang ha akon from first year. Then by the third year, mas makaritpat yung mga researches. Okay? Kung nakahimo nga nila in a short span of time with me, in one semester, how much more with you? Nagtinik kang nakita yan na. First year, second year, third year. Okay? So, I have good expectations and high expectations among you with your paper. And setting pa, one of the key factors, you listen. Okay, bisan pa kumbaga in one of the students in one of the researcher in one of the students in medical students second year medical students, and was the even telling whatever you have learned in your undergrad on researches or research, it's now different in the medical field, because in undergrad it's more like in social economic factors or something like that, or social something like medicine is a different. This one is a clinical research, public health context. Okay, so in order to learn, you have to unlearn. Okay, imo nga nito biton and you will resist change and new learnings. Ang makukurian ka talaga. Okay, in medicine, it's a different ball game already. It's a higher, ano, kung gusto it's a higher context and it has the different angles already in looking into topics or subjects. Okay, so that's all. Good morning. If you have questions, you can ask me now before we end. Kita ka mo pakiana. Liza, may napakiana waray. Ada pa ka mo?
Po, Dok.
Online pa ini? Okay.
Yes,
Yes,
Doc.
po.
O sige,
Doc,
if
here,
you have
Doc.
questions, you can PM me. Okay? So as of today, I cannot give you yet my inputs with the other papers, but I did with one on the health seeking waiver. I was so happy that you noted on that. Kay adto ko talaga ng mga previous topics diri talaga pwede. Bisan gimbabalikan amo lagyap nga istorya. Okay? And so I will check on them again, and you can PM me if I read. So as of today, wala ko pati mabasa ang iba. So you can create your own group chat nga kada group pag GC nila kamo ha ano pag GC nila kamo ha PM a messenger. So may na didi groups, di ba? May na ano groups. Butangin ano nga group. Okay? So R1 group 1, group 2, group 3, group 4, group 5 kun ano dida. R1 para dida ko kada usa iyo map dida kita mag-istorya. Okay?
Okay
Yes,
po,
Doc.
Dok.
Okay. Thank you, Elijah, for reminding me all the time. Adanan format. You follow the format. You follow the format because it's -5 automatically if you don't follow the format. -5 ang ginpapabutang ni Ma'am Lynn, pero ako nagma-3 la ako ng third year ng evaluation. Eh, syempre, di ko gusto mahulog it mga estudyante. For the effort, I want you all to pass. Okay, so I'm doing this also to defend you guys on the committee. Okay, sige. That's all. Good morning again. If no questions, and thank you very much for your patience and attention. Okay, bye
Thank
bye.
you
Okay,
po.
Doc. Morning, Doc.
Doc.
Morning, Doc.
Good morning. Bye bye.
Doc.